What is coronavirus? Coronaviruses are a large family of viruses that cause not only the common cold but also more serious respiratory illness. A novel coronavirus was identified as the source of the illness in January 7, 2019, with the infection traced to a Wuhan seafood market that also sold live animals. Countries around the world are stepping up efforts to tackle a new coronavirus that originated in China's Wuhan city. The World Health Organization, WHO, has declared a global health emergency over a new coronavirus that has killed at least 425 people in mainland China and 2 more elsewhere following an outbreak in the central Chinese city of Wuhan. More than 20,438 cases have been reported worldwide, most of them in China's Hubei province. A man from Wuhan also died in the Philippines on February 2, and Hong Kong reported its first death on February 4. The infection is now more widespread than the 2002-2003 severe acute respiratory syndrome (SARS) outbreak, which also originated in China, in terms of affected people but not deaths. What are the symptoms? According to the WHO, signs of infection include fever, cough, shortness of breath and breathing difficulties. In more severe cases, it can lead to pneumonia, SARS, kidney failure and even death. The incubation period of the coronavirus remains unknown. Some sources say it could be between 10 and 14 days. How deadly is it? Some experts say it may not be as deadly as other types of coronavirus such as SARS, which killed nearly 800 people worldwide, more than 300 in China alone, during a 2002-2003 outbreak that also originated in China. MERS, which did not spread as widely, was more deadly, killing 1/3 of those it infected. In China, however, the infection is more widespread than SARS in terms of case numbers. Where have cases been reported? Most cases and deaths have been reported in China, the vast majority in Hubei province. So far, Hong Kong and the Philippines have reported a death from the new virus outside of mainland China. The virus has spread to many Asian countries, as well as Australia, Europe, North America and the Middle East. The majority of cases outside China are among people who recently traveled there. Read more about which countries have confirmed cases here. What is being done to stop it from spreading? Scientists are working on a vaccine but have warned one is unlikely to be available for mass distribution before 2021. Chinese authorities have effectively sealed off Wuhan, and have placed restrictions on travel to and from several other cities, affecting some 56 million people. The move was meant to resolutely contain the momentum of the epidemic spreading, and protect lives, the central city's Special Command Center against the virus said, according to state broadcaster CCTV. Many airlines have cancelled flights to China, while some countries have banned Chinese nationals from entering and have evacuated their citizens from Wuhan. Where did the virus originate? Chinese health authorities are still trying to determine the origin of the virus, which they say likely came from a seafood market in Wuhan where wildlife was also traded illegally. The WHO also says an animal source appears most likely to be the primary source of the outbreak. On February 2, officials in Hubei said the virus had a 96% concordance with an already known bat-borne coronavirus. Chinese scientists previously mentioned snakes as a possible source. Is this a global emergency? The outbreak constitutes a global health emergency, the WHO has said. The decision to sound the top-level alarm was made after the first cases of human-to-human transmission outside China were confirmed. The International Health Alert is a call on countries around the world to coordinate their response under the guidance of the United Nations Health Agency. There have been 5 global health emergencies since 2005 when the declaration was formalized: swine flu in 2009, polio in 2014, Ebola in 2014, Zika in 2016 and Ebola again in 2019. How to prevent being infected by coronavirus? There is currently no vaccine to prevent 2019 Ncov infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including: wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Like, share and subscribe for more viral health cure videos.